What it will be is a paragraph by paragraph with a yes or no. It gives the patient the control over how their information is shared and with whom. I appreciate you being here for this important topic. In this day and age of data-driven society, citizens are concerned over who has access to their data, what entities their data are shared with, and even more concerned when they hear about a data breach. When a citizen considers their own data, no other data is as personal and private to them and as worthy of protection as their own health care records. The Minnesota Health Records Act has been the law of the land in Minnesota for decades. This law protects patients' data by giving the patient control via affirmative consent over their most personal medical information in ways that the HIPAA rule does not. Indeed, the Minnesota Health Records Act is stronger than HIPAA. The legislature over the years has heard passionate arguments as to whether or not Minnesota should allow the HIPAA privacy rule for treatment, payment, and operations to trump the Minnesota Health Records Act. One side wants to repeal patient consent rights for treatment, payment, and operations because they believe it will improve coordination of care and reduce duplicative tests and costs. This bill covers both of those issues. The other side opposes elimination of patient consent rights because it ends patient privacy and eliminates control over their patient's own health records. This bill addresses those concerns. This will allow patients to share all their information, if they choose, for all purposes, and extends the period of time that their information can be shared. This will be helpful for coordination of care, reducing duplicative tests, and reducing costs, and should especially be helpful for individuals with complex medical conditions. At the same time, this bill protects the rights of patients who wish to restrict access, use, analysis, or sharing of their information by retaining the current patient consent rights of the Minnesota Health Records Act. This would allow the patients to decide if their physical therapist really needs to see records related to their sex life, for example. This would also allow for a completely independent second opinion. Not only does this bill address the concerns brought by both sides of the issue, but it has additional positive impacts on patients. If a patient knows that they are in control of whoever sees their private information, they are much more likely to share openly with their doctor, especially on sensitive topics such as substance abuse, reproductive health, sexual history, mental health, etc. This leads to better care and patient treatment. This bill also addresses concerns that Minnesota consent laws are difficult for patients and providers to understand. With all providers using the same form, patients will find the consent form more understandable and the data sharing choices simplified. In addition, providers will be less confused about what consent has or hasn't been given. The universal consent form simplifies the process and makes it more transparent for both patients and providers. Our solution, introduced today on a bipartisan basis, has been vetted and unanimously approved by the Minnesota Legislative Commission on Data Practices. I would also like to add that while door knocking this summer, anytime I encountered someone that worked in the healthcare profession, I asked them about this issue, and without fail, every single one of them said that a patient should absolutely have the right to consent. And the taker was when I knocked on my own doctor's door that I didn't even know she lived in my district, and she basically said, well, it's your record, you should have control over it. In this discussion, it is important to understand why the Data Commission was concerned about removing patient consent and simply reverting to HIPAA for treatment, payment, and operations. It is important to note that the P in HIPAA stands for portability, not privacy. Most patients believe signing the HIPAA form protects their privacy, protects their health record, when in reality, they are allowing their medical record to be shared. By reverting to HIPAA for TPO, which includes thousands of entities that a patient's information will be shared with, a patient would have no say with whom their most private health information is shared. And I would like to turn it over to two of my colleagues now First of all, Senator Warren Limmer, who is the Vice Chair of the Data Practices Commission. He will address these patient consent forms, and then I'd like to turn it over to Representative John Lesch to talk about the legalities, the differences between the Health Records Act, Minnesota Health Records Act, and HIPAA.
Thank you for coming. For the record, my name is Warren Limmer. I'm a Republican chairman of the Judiciary and Public Safety Committee in the Minnesota Senate. The whole issue of data privacy has been a major concern of mine as well as the Senate's for quite a few years. Matter of fact, Minnesota has a very long history of being known as a privacy state. We honor and respect the privacy rights of our individual citizens as opposed to giving free rein to government as well as corporations. We believe that the protection of citizens' rights in the areas of personal privacy are of an utmost concern and priority. However, as we've begun to notice, and this bill hopes to address, is the need for a uniform consent form that would help not only the industry handle the process of sharing information, but giving the control, again, to the private citizen. After all, it's their records, it's their health, and they should be the ones to be the supreme user and sharer of that information. Some of the examples we found and the need for uniformity can be seen in a number of the forms that we've collected from corporations over recent months. There's even a form here which I find to be almost unbelievable, and it says, if you do not sign this consent form, we have the right to refuse you treatment. Now that's a very serious charge. It's a serious claim by a corporation who is supposed to be working within the rules and the laws that we have established in the state of Minnesota. Uniformity brings common data fields. Common data fields creates an easy passing of information when the patient authorizes that passage. We think the bill before us is vital right now. After all, the Minnesota Health Records Act was created about 30 years ago. It's been tweaked over the years, but back then, 30 years ago, we did not have the digital industry that we have now. And we recognize that there should be some adjustments to it to improve the health and safety of our citizens, but always remembering and keeping supreme the authority of the individual patient, the citizen, for their healthcare needs, their passage of that information to another user or another health system. That should be in the hands of the patient. We even have on the consent form, if a patient wants to just check a block that says, I want to share this information with anyone that needs it, without further review, without further complications, they can do that. We're giving the citizen the right to control and choose where their information goes. It's a rather wide flexibility, but at the same time, it puts our individual citizens in control of their own health care. Thank you.
I'm proud of the work that Representative Scott has done, Senator Limmer have done on this in past years, including this year. And I think it's instructive to know that the push that you've seen the industry make over the course of the past few years to say, no, you know, come on, we should be able to trade this personal health information between each other. It's just a real big headache for us, and you know, we're going to make it smoother for everyone. It helps them. It does not help the individual Minnesotans who need to avail themselves of health care. And let me be clear, it's not anyone's business whether you have headache, heartache, cranberries, or herpes. It doesn't make a difference, and no one should be able to know that unless you say that it's okay for someone else to know. And I'll tell you that Representative Scott has worked hard on this legislation with the Minnesota Commission on Data Practices, and I would note that in the past few years, when you've seen the industry push to say we're going to erase individuals' right to control their own data, that you have seen the significant players in the legislature, including Representative Scott and Senator Limmer, say, you know what, we think we're going to protect Minnesota's private medical data. Now, the Minnesota Health Records Act, as has been noted, has a long history in Minnesota. It was crafted around the same time or a little bit after we created the Minnesota Data Practices Act, and that was designed to protect the individual's right to their own information, to protect their privacy. We're not going to back down on that. And one important piece that I think legally that you would note here is that there's a private right of action for you to allow you to litigate the privacy interest in your data in Minnesota. With HIPAA, there is none. You have no safeguards if someone screws that up to personally go after that. You have to wait for the gears of the government to come around and grant you justice after the horse is already out the barn. In Minnesota, we believe more strongly in the personal privacy rights of our citizens than HIPAA does, and that's why I think this legislation crafts a good middle ground that the industry should be happy with, but we also protect the personal privacy rights of our citizens' personal medical records.
Thank you. I'm State Representative Eric Lucero, and to that point, when software developers are putting together applications that allow interoperability and the sharing of information, it makes it, or it is a requirement that there are certain data fields that are common among the systems. And having standardization of the form will allow the software developers to develop the code that allow for that interoperability more easily. But in addition to the technical aspect, it also allows the individual to become familiar with the form and the questions asked on the form when they're visiting their different providers and doctors' offices, because having an understanding both on the technical side and from the individual side, again, is the objective for the ease and the ability of people to make the best decisions that they want over their own information and personal medical privacy. Thank you.
What it will be is a paragraph by paragraph with a yes or no blank on the form. Yes, you can share my information for treatment. Yes, next paragraph, you can share my information for payment, and so on and so forth. So it'll be, and as Representative Lucero said, this will be the same form that every provider you go to is going to have. So you're going to, the advantage to the patient when it comes to some of us, our eyes glossing over when we look at those forms, is that it's going to be the same form every time. And across Minnesota now, as Senator Limmer pointed out, every form is different within every corporation. So this puts it all on one piece of paper, and it gives the patient the control over how their information is shared and with whom.
Total information that would be shared is both a blessing and a curse. The blessing is that it would speed along the diagnosis, the treatment, the knowledge of past treatment with an individual. However, the curse is that that information could be shared with a variety of individuals, a variety of corporations, a variety of governments. And as we know, any data list that's held by corporations or by government are subject to breaches. Breaches occur every day. And that information could be abused. It could be used for both. I believe it could be abused for some rather bad purposes. And it's vitally important to recognize the autonomy of every individual. And that autonomy that individual should control the destiny of their own data regarding the most intimate pieces of information regarding their health.
There's another curse, I would say, and that's that oftentimes in clinical settings that there's assumption that more data is always better. And when you have let's say, a 68-year-old man with a lifelong history of medical treatment among dozens, if not hundreds, of different providers, and all of that information is provided with medical records, it is incumbent upon that provider to to review the entire record. If not, and I don't practice in the area of medical malpractice as an attorney, but I can tell you that I know folks who do. And if you miss something in all of that data, you're going to be held accountable for it if something goes wrong. And that means that the systems in each one of those offices, those healthcare providers, are going to demand a complete and thorough review of the record. So if you've got a 67, 68-year-old man with a history of records across multiple providers, that's their liability if they miss it. It's not always true that more data is always better. It doesn't necessarily make you healthier or safer in every instance. This push by the industry is not about making you healthier. It's about helping their bottom line so that they do not have to jump through the hoops that personal privacy demands that they do right now. It has nothing to do with making you healthier. It has everything to do with protecting their bottom line and their systems.